Hi, everyone. My name's Allison Rohrbach. I'm the Associate Director at the University Health Center here at Towson University. I'm excited to share some information about the Health Center and what services we can offer for your students. So the first thing is just to know the different services that we do provide. So we can see your students for all different types of health issues. They can come in and see us if they have things like colds, flu, sore throats. They can also come in for their physical exams, annual exams. We can do allergy shots. We actually also have a lab on campus in our health center through Quest, so we can do laboratory testing as well. You'll also see that we do have a massage therapist. She's actually not working this semester because of COVID, but during normal times, we do have a massage therapist who's also available. Here are our providers at the current time. So we have 2 medical doctors as well as 3 physician assistants and a nurse practitioner. There's also a physician assistant position that we are still in the midst of getting ready to fill. So there will be another provider as well. So these are all of the providers who can see your students for their different health issues. So making appointments. So we are open Monday through Friday from 8 a.m. to 5 p.m. There is a nurse advice line that is available after hours. So if students call that phone number 410-704-2466, they actually can, that's our main phone number to the health center, but that's who they can call after hours if they need to get in touch with our nurse advice line. And they can give them advice on what they should do if they're feeling ill or there's a health issue, and whether or not they should go to the hospital or urgent care, or whether they can come see us the following day. The other way that most students like to make their appointments with us is through our web portal, and that's tigerhealth.towson.edu. They can call our main phone number, which is 410-704-2466, to make an appointment. Normally during non-COVID times, they can also walk in, but we are not doing walk-ins at this time because of COVID. We have very specific things that we have to follow as far as who can be in and out of the health center, how many people we have in at a time. So walk-ins actually are not accepted this semester, but I'm assuming that by next semester we will be able to do that. And we want students to know that it's important that they do make an appointment if they can, but we will accept walk-ins, not during this semester though. Payment and insurance. So we do accept health insurances. So that's the way that students will pay for their appointments when they come in. They'll bring their health insurance card with them. We work with most major health insurance plans. I always suggest to parents that you call the phone number on the back of the insurance card, let them know that your student's going to be here at school at Towson University, and make sure that they're participating with us. Copays are billed after, so we don't accept copays up front, and they're billed to their bursar account. We do have something through Aetna Student Health that is a health insurance plan for students who do not have health insurance. That's not something that they're automatically billed for, so we don't do the hard waiver. But if your student does not have health insurance and is interested in learning more about the plan, they can go to aetnastudent.health.com and just click on Towson University from the dropdown. That'll let you know everything about what's covered, services, payment, that sort of thing. So immunization requirements. So this is probably the most important thing that I need all families to know is that all of your students are required to submit their immunization requirements. So for students, whether they're living on campus, off campus, whether they're just doing all online, virtual for this semester, have to turn in the following. So we need proof of 2 MMR vaccines, so that's the measles, mumps, and rubella, the Tdap vaccine, which is the tetanus, diphtheria, and pertussis, and then also the tuberculosis risk screening questionnaire. And I'll go through all of those. Students living on campus also have to provide proof of the meningococcal A vaccine, but we also recommend the meningitis B vaccine. So all of this is actually due to us by January 25th. Students not in compliance will be fined and have a registration hold put on their account for registering for the following semester. So it's really important to make sure that we have all of this in. These are requirements and holds will be put on their accounts. So how you get this information to us. So the first thing we need you to do is to gather your immunization records. So if you go to this link at the bottom here, you can actually print out the form that we have through the health center. You can take that form, have your doctor fill out the top part that says the measles, mumps, rubella, and the tetanus, diphtheria, pertussis, the dates, and also fill out the tuberculosis risk screening questionnaire online, which I will show you. And then the provider can sign this and then you will upload it, and I'll show you how to do that. The other thing you can do is you can just go to your doctor's office and have your child's immunization records printed out. So you wouldn't have to do this form. You could just print out those records and you could upload those. So how you upload your immunization. So the first thing you're going to do is you're going to go to our website, which is towson.edu/health center, and there's going to be a large red box in the middle of the screen that says welcome new students. You're going to click on that red box, and then you're going to go to where it says username and password. You're going to put in your student's username and their password and click proceed, their date of birth and click proceed, and then you're going to come to two links. One is required immunization history and the other is the tuberculosis risk screening questionnaire. You'll click on the first one for immunization history, and then you'll go through each one and put in the dates of your students' vaccines. So the first is for MMR, the next is for Tdap, the next is for meningitis. So you're going to enter all those dates. Then you're going to click on the box that says add immunization record, and that's going to be how you upload the immunization record. So let me go back to that. The way that you upload the immunization record is you can take a picture of the immunization record, you can scan it as a PDF, however you want to, and then you just add it. You click that button and you add it in. And then you go to submit final, and that's how it'll be uploaded. Next is the tuberculosis risk screening questionnaire. So you'll click on that link, and that's going to take you to this questionnaire that asks a bunch of questions. The questions just basically ask if you were born outside of the United States, been around someone with tuberculosis, been in certain professions where you may be more at risk. So you answer those. If the answer is no, you hit submit final and you're done. If the answer is yes, then it's going to ask you to submit a tuberculosis test for us so that we can make sure that you're immune. The following, and so let me go back one more time. So that's everything that needs to be done for immunization. So again, 2 MMR vaccines, Tdap vaccine, and tuberculosis risk screening questionnaire have to be done by all students, whether they're living on campus or not. If students are living on campus, they have to do all of those and also submit information about the meningitis vaccine. And again, all of that needs to be into us by January 25th. Okay. Also, there's an opportunity to upload your insurance card through the electronic health record through the web portal. So you can take a picture of the front and the back of your insurance card, and that can be uploaded and it'll go right into your child's medical record. So you just take a picture of those and click save. And then last is just about privacy. So we really ask that you understand that all medical information for students that are 18 years or older remain private. Students are able to grant permission for specific things in their medical chart, but it's all episodic. So it's not a one size fits all. I'm going to sign a blank form that my parents can see my entire medical record. That's not something that we do. In emergency situations, so for example, if your child is severely ill or going to the hospital or unconscious or able to speak or communicate, we will contact whoever is designated as the emergency contact. So that person will be informed. And then last, here's just my information as well as Allison Seeley, who's our assistant director. We put our actual phone numbers and email direct lines and emails on here for you because we want you to be able to contact us directly. If you have any questions at all, or if there's anything that we can help you with, we'd be more than happy to. So that concludes our presentation. Thank you so much.